Hey guys, I'm here with Angie, who you might recognize as one of our patient coordinators. And today we're going to be chatting about some of the common questions we get on a daily basis at Skin Technique. Our patient coordinators are usually the first point of contact, whether it's on the phone, via email, or people walking in off the street. So as you can imagine, we get a range of questions. Some of them are quite entertaining, and we'll share some of them today with you. Ange, what's a common question you get asked every day?
One of the most common questions that I do get asked over the phone is how much per unit are anti-wrinkle injections?
And what do you normally say when they ask that?
It's a very tough question to answer without seeing the patient first. We base basically the value of the treatment. So it's more about your experience here, who you're seeing, the knowledge of our physicians. It's tough to answer without actually seeing the patient in person.
It's something we encounter a lot where people will ask us how much. And without having a thorough assessment and understanding that each face is different, it's impossible to answer that question. People also get fixated on the cost per unit of something rather than the experience in the clinic, the experience of the injector who's performing the service. And that plays a very large factor in deciding what the cost of the service is going to be. What's another common question you get?
We get a lot of interesting questions. Some funny ones are like, how many days before my treatment do I apply numbing cream?
How many days?
How many days?
And what do you say?
So we say with numbing cream, it does only last in your system for about 1 to 2 hours. So you would actually just apply it on the day of 45 minutes or 1 hour before your treatments.
Do you get many questions regarding downtime?
We do. One of the other common questions that we get would be, how many days or weeks do I need to take off after injectable treatments?
Days or weeks. So, fortunately, with the way the procedures are performed these days, the downtime is usually very minimal. In fact, most of our patients come to us, sometimes even during their lunch break, and go back to work, back to regular activities with a few do's and don'ts, but the downtime is less than you'd actually think. Another question we get asked both in the consultation and over the phone is whether injectables are safe when you are pregnant or breastfeeding. We always answer this question the same way. No, it is not recommended during pregnancy or breastfeeding. There is no significant data that suggests it's unsafe, but there is also no significant data that suggests that it is safe. So for an elective cosmetic procedure, have your baby, breastfeed your baby. Once that's all done and you're ready to get back to your aesthetic treatments, that's when you can come and see us again. So Angie, a lot of patients must have fears when they are speaking to you on the phone. What do you find patients are most concerned about?
A lot of patients do ask, does the treatment hurt and will they look unnatural after the procedure?
Those are two very, very common questions. Is it going to hurt? This is a question that is best answered when you are in the treatment room and you see the different measures we take to make it extremely comfortable for you. Some people have a low pain threshold, some people have a high pain threshold, but we treat everybody the same way using the same anesthetic remedies that we have, multiple distracting devices like our vibrato tool, and good old ice always goes a really long way. This question about looking unnatural is a very valid question. Unfortunately, we always reference the most unnatural results we've seen when thinking of getting a cosmetic procedure. But our focus is always very naturally driven results, and I think they speak for themselves. So what are some of the more outrageous questions you get asked?
A really funny question that we were asked was, will my sunscreen help prolong the longevity of my injectables?
Your sunscreen is a very crucial part of your daily routine. Using a moisturizer is always good, but it's not necessarily going to make your injectables last longer. Are you noticing an increase in men calling and asking for appointments?
I do. I notice a lot of men lately that have been more interested in a lot of our injectable treatments. Also, a lot of their wives call in for them as well.
Yes, I have noticed a lot of the time, especially with PRP hair restoration, most of those appointments were made by the patient's wives. But it's interesting because it creates a leeway into other cosmetic treatments, and almost every patient, male patient that comes in for a hair restoration treatment has a lot of questions about body contouring, facial fillers, facial treatments, skincare products. So we're definitely seeing an increase in the male demographic at our clinic.
When patients call in over the phone, they normally specify exactly what they're wanting to get. Do you always perform that exact treatment that they're asking for?
No, I think that is why the consultation process is so important, especially if we're seeing you for the first time. Sometimes patients think they know what they want, but it's not necessarily what they need. And oftentimes, patients don't really need the treatment that they are requesting. So we say no a lot of the time when a procedure is not the best suited to that patient. And we rather focus on educating the patient and having a thorough consultation to help them understand what it is that they actually require to get the results that they are looking for.